To whom it may concern, there is currently a public outbreak of strep throat, also known as streptococcal pyogenes, better known as Group A streptococcus, which is currently ravaging nearly every major continent. Please continue listening to this broadcast as we transfer over to Dr. Spencer Sau to detail more about the pathogen.
This pathogen is a type of bacteria and is transmitted between people via close or direct contact with the mucus or sores of a carrier, which are located in the mouth and throat. One could also get it from sneezing and coughing, which release droplets filled with bacteria into the air, ready to infect others in public areas or in your own household. In general, strep throat is highly contagious to family members and strangers alike. If a family member of yours has strep throat, we advise that you maintain a safe distance, wash your hands, and avoid as much contact with this person as possible. Regarding its mortality and morbidity rates, strep throat can cause scarlet fever, which has a mortality rate of 15 to 20%, toxic shock syndrome, which has a mortality rate of 30 to 70%, necrotizing fasciitis, which has a mortality rate of 30 to 50%, and rheumatic fever, which has a mortality rate of 1 to 10%. If you contract strep throat, we advise that you seek immediate medical attention if your symptoms do not go away within a few days. Regarding the origin of strep throat, it was discovered in 1883 by Austrian scientist Theodor Billroth, and then noticed several years after in numerous European countries. Regions that are still affected include all of Europe, both Americas, Asia, and most major continents except Antarctica. Since it is a common bacterial infection and spreads easily via contact, it affects millions worldwide with over 3 million cases in the U.S. alone. Please hold while the other scientists working on this global pandemic follows up with more information.
There are a variety of signs that may indicate that an individual, most likely a child, has strep throat. Those with strep throat tend to gradually develop an immensely sore throat, making it hard for them to swallow. Some of the other symptoms may include, but are not limited to, having a fever of 101 degrees Fahrenheit or higher, the growth of swollen lymph nodes on your neck, the development of tiny red spots on the roof of your mouth, red and swollen tonsils, and occasional headaches accompanied by vomiting. In order to diagnose strep throat, the doctor will likely first conduct a physical exam to look for the symptoms of it. Once identified, there are two main tests that doctors typically use. One of the two, known as a rapid antigen test, involves taking a swab sample from your throat and then testing the sample for antigens in the throat. If the test indicates a negative result for strep throat, the doctor may confirm this by proceeding with the second of the two tests, which is slightly more extreme. It is known as a throat culture. This involves taking a sterile swab, rubbing it over the back of the throat and tonsils to get a sample of the secretions. The sample is then cultured in a laboratory to detect the presence of bacteria. In terms of prognosis, the symptoms of the strep throat usually resolve themselves within 3 to 5 days, regardless of whether or not you seek treatment. Although transmission is still possible, antibiotic treatment severely reduces the risk of complications or transmission. The major two complications that may arise as a result of poorly treated strep throat are scarlet fever and acute rheumatic fever, especially in children. Strep throat is almost universally treated by the use of antibiotics, which kills the infectious bacteria. This is what makes strep throat unique, as other forms of sore throats tend to not require the use of antibiotics as they are caused by viruses, not bacteria. The antibiotics are usually administered either as a pill or given as a shot. The most common antibiotics used are penicillin and amoxicillin, and you should take the medicine as instructed by your doctor. In order to prevent strep throat, be wary of those around you who have quote-unquote sore throats, as it may actually end up being strep throat. The bacterium are usually easily transmittable, so make sure to try and keep your distance. Strep throat often spreads late in the fall and early spring when children are in school. People 5 to 15 years old are most likely to get strep throat. The safest thing you can do during the time of year to prevent catching strep throat is to simply be wary of your surroundings. Make sure not to touch places of high concentration of bacterium, such as doorknobs, and then touch your skin. Additionally, you should try not to share personal items with those that may be sick, and you should minimize your bodily contact with such people.
Thank you all for listening to this public service announcement. We advise that you all stay safe and prevent the spread of this global pandemic any further. If you have any questions about streptococcal pyogenes, also known as strep throat, please do not hesitate to call your local hospital or doctor, or call us at 1-800-888-8888 for further medical information.
This has been your strep throat public service announcement. Thank you.